It's the #1 most common cancer among men, prostate cancer. And cutting-edge technology at United Regional is helping cancer patients get back on their feet faster.
In this evening's Healthy You, we're going to meet John Howell, who, like his father, his grandfather, also a nephew, got news from the doctor no one wants to hear.
Nothing can prepare you for it.
It's difficult to explain the feeling. It's the C word, and everybody panics when they hear the C word.
A C word Wichita Falls resident John Howell knows all too well. His father and grandfather both battled prostate cancer before genetics took its toll on him too.
I had a PSA of 4 for several years, which is considered high normal. It jumped to a 7.
It's a simple blood test, and it has a role in screening for prostate cancer. The standard range on the lab value is 0 to 4, is considered normal.
After the initial shock set in, next came the hard part for Howell and his family.
He gave me 3 options. He said that I could watch and wait because it is a slow-growing cancer. He said I could do radiation, or I could go through the surgery. My wife and I spent quite a bit of time praying about it and felt that the surgery was the wise way to go.
Howell made sure to ask all the questions of his United Regional urologist, Dr. Paul Morrison, and then that day in September 2020 arrived for Howell to have his robotic prostatectomy.
I drive all of the robotic instruments, and so throughout that process, like I have a high-definition camera system and a viewing port where I'm using the joysticks to be able to drive all the instruments. Before, you had very straight laparoscopic sticks, and now we have the capability of the laparoscopic instruments to make wristed movements like rotation, bending, grasping, and flexing. And so it mimics a surgeon's hand.
A successful surgery is exactly what the doctor ordered and what the patient prayed for, but neither realized just how successful it really was until lab results came back.
Dr. Morrison found a second cancer, and that second cancer was undetectable. It was aggressive, and if I hadn't done the surgery, I probably wouldn't be sitting here talking to you right now.
Prostate is the most common cancer among men. Those at higher risk are older men, African American men, and men with a family history of the cancer, men like Howell.
I have had prostate screenings every year for the last 10 to 12 years, and I think that was critical. It was caught at an earlier stage than it would have been if I hadn't done that.
Howell now looks back at his journey knowing he made the right choice.
I am so happy that I elected to use Dr. Morrison. You think of small towns and you think, maybe not the best medical care. I couldn't have asked for anything better.
A second chance at life, a chance now to share his story. Now, I want to thank John Howell for sharing his story with us. He's completely recovered and is now back to playing with his grandchildren and working in his shop.
Oh, that's wonderful. Dr. Morrison says robotic surgeries, they're minimally invasive and they're meant to get people out of the hospital sooner and in less pain.